Okay, well, the title, let me just talk about this title. Um, there's some slides here on post-COVID, but the data was really hard to find because it's just too recent. And so I have something, but if that's really what you wanted to hear about, unfortunately, I'm not satisfied with what I'm sharing on that because it's just too new. Um, but also I was given the whole, in there was um, drinking and heavy drinking. And that's one of my favorite topics, the impact of heavy drinking on health. So we'll actually do more on that, but let's just see what we're going to do here. Here's the stuff we have to do, and this is the stuff we have to do. Um, I have a consultation company that's keeping me busy now that I'm winding down clinical work. But yes, I do work for pharma because I really believe that, we have a public health problem with addiction and a huge problem with adoption of pharmacotherapy. So anything I can do to improve adoption of pharmacotherapies will help patients. And I really see medications in our space and commercial bias as a lot different than cardiology and psychiatry, where it's new, expensive Me Too drugs. But in addiction, we need to promote the use so that maybe there will be enough of a motive for drug companies to research and develop new things that can help our patients. So I am back on the clinical faculty as a full professor and also have a position with medical college and their fellowship. And for the next 3 weeks, I'll continue to be working at Connections Counseling, but then that will go away as well. So I'm an addiction specialist, unabashedly so. And so I talk about addiction, but many of you are in primary care, and I really do think that the issue of heavy drinking is more relevant on a public health basis and in primary care. I care about whether somebody has addiction and what the treatments are for that, but heavy drinking is really the driver of health issues. So what is heavy drinking? Well, heavy drinking is more than 15 drinks a week for a man and more than 8 drinks a week for a woman, which is different from binge drinking, which is measured on a daily basis. And it really is sort of interesting. I talk with patients about, are you drinking with a small d or a capital D? Or did your dad drink with a small d or capital D? They immediately know what I mean. But what I'm trying to get at is an addictive pattern of drinking. And when you're talking about drinking, it's how many drinks. And in the United States, it's about 13.6 grams of pure alcohol. And these slides may be from the Clinician's Guide from NIAAA. But basically, 12 ounces of 5% beer or 5 ounces of 12% wine or 1.5 ounces of 80% liquor will get you that 0.6 fluid ounces of pure alcohol, which is the US definition. But it's also important to recognize if you're reading a paper from the UK or maybe even the British Empire, they do talk about units of alcohol. And if you read units of alcohol, they mean 10 grams, not 14 grams. But our literature in America talks about standard drinks. So binge drinking has been sort of redefined, a little bit more sophistication by the feds to say it's that amount of drinking which will bring you to drunken driving. This typically occurs with the levels of drinking we talked about within 2 hours. So the idea of 5 a day or 4 a day, well, more specifically, it's that you actually get tipsy or to a dose that would get a person without tolerance tipsy. And the important thing is that alcohol use disorder or alcohol dependence or addiction is not the same as heavy drinking or binge drinking, and that's really a take home from this. So there's a new term by the CDC, excessive drinking, that includes binge drinking, heavy drinking, underage drinking, and drinking by pregnant women. So that would be considered certainly risky use. They don't use the terms of risky, harmful. They have the term of excessive use. There's a lot of terms out there. And 90% of people who drink excessively would not meet the AUD criteria. And a couple of references for you here. Now, I did provide for you, and I think everybody that registered got a slide set of 40 slides and pages of literature from the librarian at Meriter, Robert Kohler, who helped me prepare this. And so when you see an author, you can go later to your handout, and actually I have actual, either from the body of the article or from the abstract, actual sentences from these articles that convey the key points. So that's your bedtime reading at a future date. 1 in 6 U.S. adults binge drinks about 4 times a month. And it's really interesting, the total amount of alcohol consumed by binge drinkers. There was a statistic a number of years ago that's been revised a bit. It used to be addictive drinkers, but now if we include addictive drinkers, binge drinkers, underage drinkers, we now get to the level of 50% of all alcohol sales. And so the business model for any distiller, or maybe even vintner, but certainly a brewer or distillers, they depend on unhealthy drinking because people who otherwise drink at rates that wouldn't sell much product. Binge drinking is most common in young adult age groups, even though half of the total binge drinks are consumed by those 35 to infinity. So this Canny article is a nice article on binge drinking. It's twice as common in men as in females, and it's actually more common in the more affluent groups. It's kind of interesting. But those binge drinkers who are in the lower income and educational levels consume more per year. And it's the consumption that drives health problems. Wisconsin stats, we're third in the country in adults in adult drinking. We report current alcohol use at high rates. And again, there's a lot of states that have very low rates, and a lot of those are Bible Belt states and Utah. But it's really important to know that when Wisconsin adults drink, it's more often and it's heavier consumption per episode. We really are a large consuming group. And it's interesting, adolescents don't drink more frequently or have more binge drinking, but their perception of harm is very different. And we know the perception of harm is a big driver of use of a lot of different things, including cannabis, including vaping. And, that's one of our big public health problems is the perception of harm from vaping is too low and perception of harm from cannabis is too low compared to the actual public health problems that they cause. Alcohol, heavy drinking, binge drinking is so acculturated here, the kids just don't see it as an issue. And of course, they see adult role models doing it all the time. Now, I don't remember if I gave you full page versions of this in the handouts, but the Wisconsin Department of Health Services website does have really nice stuff. Actually, or is this Department of Health Services website? Not sure. And it breaks down binge drinking by county and by ethnic group and by age group, and alcohol attributable deaths. So there's some really, really good data that the state has prepared for us, but it doesn't really get us into the pandemic well enough and to look at changes since the pandemic. This one actually does. This has got some 2020 data, and of course the shutdowns began in March. Now, there's other great data at a totally different site, not the state government, but the law school. And Julia has done a wonderful job as the principal investigator for the alcohol policy project through the law school, looking at harms from alcohol, ED visits, and major health consequences, including liver disease and cancer. Liver cancer is specific in this particular slide. It's the 5th leading cause, risk factor for the development of chronic disease in general. Now, one of the great projects on heavy drinking was done by Tom McClellan and an associate in the Department of Internal Medicine. Pardon me, her name escapes me, but she's retired now, just as Tom is. This is old stuff, but they were looking at the contribution of drinking to chronic illnesses managed in internal medicine clinics. And they found that alcohol contributes more to the risk of hypertension than does salt intake. It's just really fascinating how much alcohol is a driver of health outcomes. And one of the reasons it affects health outcomes is because it affects adherence to treatment plans for chronic diseases in primary care. Alcohol and public health is just a really big topic. 3.8% of all deaths and 4.6% of disability adjusted life years are attributable to alcohol. It's just a big deal. And most people think of cirrhosis, but it goes way beyond that. Cardiovascular disease is huge. Cancers of a million kinds. It's not just liver cancer, it's cancer all over the body. Bladder cancer, and it's not just where the alcohol goes in the digestive process. It's stomach cancer, it's liver cancer, it's bladder cancer, but it's everywhere cancer because it's so water soluble and it goes everywhere. There was, in my library, I found a marvelous issue of alcohol and health produced by, that was an NIAAA publication? I'm trying to remember. But Alcohol Health and Research World, an entire issue on cancers. And a lot of oncologists are now getting interested in the broad impact on cancer by alcohol as both a toxin and as an immune system inhibitor. Now, again, binge drinking is one that can lead to, there are concerns that, this is an interesting article, that the high BACs achieved in binge drinking is itself more toxic than chronic low-level exposure. That's a new feature that I hadn't heard of until I got this. And I think, if I'm not mistaken, this is the new name for the alcohol, was its Health and Research World Journal. The name's been shortened. Okay, Bernardino article, again, lots of cancers and worldwide issues. And so this is true not just in the developed world, but in third world countries. And so I encourage you to take a look at Bernardino for stuff on alcohol effects on liver disease and other illnesses. And if you didn't hear it, I remember the impact on me when I first heard it, so I tell patients this, and that is that hepatitis C is sort of a chronic, low-grade condition in many people, but when you associate heavy alcohol use with hep C, then you start getting severe dysfunction and cirrhosis and death from hep C. So if you want your hep C to go from a chronic benign indolent condition to a really rampaging condition, just drink heavily. So that's part of my patient education stuff. Okay, and then of course, when you combine tobacco, you can also get lots of cancer and cardiovascular disease. Now, we're all familiar with the literature saying that alcohol can be healthy for you in low doses, and that has all been reanalyzed. And so I've got some good articles in the bibliography for you on that. Patients, the public, look at that and say green light to drink. And really, all of the stuff on any cardiovascular benefit is 1 drink a day, maybe 2, but primarily 1. And that benefit totally goes away at 4. And huge negative health impact of drinking at 5 drinks a day or more. So our public reads the articles they want to read and take away the messages they want to take. And I love this title of the editorial. Just like we have in our smoking work, we've said there is no safe level of tobacco consumption and any reduction improves health. There's actually accumulating data that says no level of alcohol consumption improves health and any reduction is helpful. And this is, again, totally separate from addiction. Now, what's been seen more recently in the last decade, these very fascinating and striking drops in life expectancy in the United States. It was only by 0.1 years, but it happened a couple of years in a row. Then it plateaued, and then we, of course, had COVID. So a lot of hypotheses about deaths of despair being related to loss of manufacturing jobs, just these cities in the Ohio Valley and Appalachia or in the Mohawk Valley of New York devastated by economic changes, changes in American family structure and social supports, and the deaths due to suicide, drug overdose, and alcohol liver disease. So it's been a bad triad, suicide, overdose, and liver disease. And again, most of the changes were fascinatingly in middle-aged and maybe upper middle-aged whites. And interestingly, when you really pare down, it's more alcohol than it is. I think that's what it says. But let me go look at the slides. So again, life expectancy did decrease, and this is in federal stats, and it declined for a number of years, and then in 2018 it plateaued, and then we had COVID. And the bottom line is maybe the next slide. Yep, overwhelmingly driven by booze. Okay, now it's interesting that there were some improvements in Black life expectancy over a good while that were wiped out in that same change. So let me kind of see what's changed in the pandemic. The biggest data point we have is retail sales and the number of gallons of beverages in different jurisdictions that were sold. Alcohol sales after the shutdown just went through the roof. Again, an association between sales and reported heavy drinking. People said, yeah, we didn't just buy it and hoard it, we drank it. And again, it was more weekday using, was more daytime using. And so whereas alcohol use traditionally is weekends or after work during the week, with all the stay at home, before noon drinking went up. So those data points have been found. And in Wisconsin, look at the numbers. Ready to drink cocktails, 100%, so double the sales. Big dose unit consumption, half gallons, and how about 30 packs of beer? So some interesting statistics on sales. And it's not the same everywhere. Wisconsin, the weekend drinking went up. Actually, this says weekend drinking went way up the first weekend after the quarantine. But in Ohio, it was different. So interesting data source backtrack. So one of the things that was found was that, sadly, it wasn't just recruiting new heavy drinkers. Amongst heavy drinkers, their consumption went up during the pandemic. Changing landscape. I got a bunch of articles here of international stuff, and I found it just fascinating. So I included them for your reading interest. Ireland data, New Zealand data, France data. And you can find all this in this article and some others that are in your bibliography. What about drug use in the pandemic? That was very interesting. And what this said was looking at trauma patients and drug and alcohol assays in emergency room patients, they found that of people that got injured, there were not an increase in alcohol-related trauma patients, but positive drug tests in people presenting with injury for trauma in level 1 and 2 trauma centers in Southern California went up noticeably during the pandemic. So a lot of different effects. And so that was a potpourri. Hope you enjoyed it. Hope you enjoyed the other reading. And we can have a few minutes of discussion. We have some time left.
Yeah, great. Thanks so much, Dr. Miller. Really appreciate it. For any questions, can feel free. We can try just unmuting, or if you prefer, you can put it up in the chat and I can relay.
I'm not sharing anything now, am I?
Got a gray screen up there.
Hey, Mike, it's Kelly. Great talk. Good to see you. I am just always struck by, I mean, in my transition from the West Coast to Wisconsin, struck by the amount of alcohol I see consumed here in the settings where I practice clinically.
Mm-hmm.
And I saw a patient in the outpatient setting a couple of weeks ago who sort of explained his alcohol use as summer came, it was COVID, and I started drinking heavily, like as if sort of that's just, or COVID was wrapping up, he said. Sorry, I misspoke. But like just sort of explaining that it's so normalized in our culture, both in Wisconsin, but across the United States, that alcohol isn't seen as a concerning substance in the way that other substances are. And I think I like to acknowledge that to patients, especially when they're struggling, because a lot of times, like, separating themselves from our culture that's so focused around alcohol is really hard when they're trying to make intentional behavior changes. So
Well,
this is definitely a primary care issue.
Yeah, different aspects of this, Kelly. You're getting to the issue of perceived harm. Perceived harm is pretty low here. We can't get our legislature to do squat about drunk driving. I really loved it one time when I took the northern route back from Boston. So I went through Ontario, and they have signs. First offense drunk driving in Ontario is a 6-month impounding of your car. That's an easy law to pass and enforce if there's the will. Wisconsin, there's not the will to do anything. So we have a perceived harm here that's extraordinarily low. And we did have the data point I shared that kids have a very low perceived harm because it's so acculturated. We've had to work very hard on alcohol in the home for high school graduation parties. Parents buying a keg for a high school graduation party for their 18-year-olds to drink, because it was 18 when the parents, were drinking when they were 18, and they just believe it's a rite of passage. The other difference you see compared to California is prices. And in Wisconsin, beer is cheap because historically was made here, and so the legislature won't tax it. But in California, wine is cheap because they won't tax wine. And so if you're looking at policy studies, taxation does drive use by youngsters, and that's the ones we want to stop from becoming users. Price does affect them when they don't have much money, and taxes vary based on price. Bourbon prices are low in Kentucky. Tobacco prices are low in North Carolina. That's what legislators do. And it's a very anti-public health approach. We should have national standardized taxation, but again, taxation is a local issue.
Yeah, just to re-emphasize the point, we certainly on our services see the struggles and the suffering associated with an overt alcohol use disorder, but so much more in terms of societal cost is attributable to the sorts of patterns you spend a lot of time describing, with the binge use and motor vehicle accident and other accidental injury, and something that unfortunately is a pattern that gets normalized here as much as anywhere. And it's certainly something to have an eye to, as we're talking to patients about alcohol use, is that patterns that fall short of use disorder are not safe, as you said so well.
Yeah, there's so many things about attitudes and beliefs. We know in college drinking, the college drinking is a lot less than college students think it is. So college students think the norm is much higher than it is when you actually get into the facts of it. I want to really look at the literature in the future for the one point today about the toxic effects of acute high BACs. We know something about effect of nicotine on the fetus at critical periods. I mean, it's not just overall exposure. There are critical periods of exposure, and maybe this binge drinking that's done is particularly toxic. And we know the one other thing, and then we'll wrap it up. The statement that I do like to share all the time when you're talking with parents or whatever is that not every kid drinks, but kids who drink don't drink like adults who drink. Kids do not drink socially, they don't drink with meals, they don't drink at religious events. They drink with others in huge amounts. They slam, they get drunk fast, and they rise their BAC fast, which can lead to all sorts of health effects, not just falling out of trees and tripping over curbs, but making mistakes with firearms, getting intended pregnancies, either creating them or getting them. I mean, and so the kids binge drink. There's not much social drinking of kids of sipping a cocktail. And so the reason to promote abstinence in kids is because kids are not going to drink like us. And trying to teach kids how to drink, that's kind of a joke, because maybe at the dinner table they will have a glass of wine with the standing rib roast, but outside of your view, they ain't going to replicate that behavior. And so that's just some important messages to throw out there. So that's it for me.